Project 7B Natural Birth Simulation. Ventouse-Assisted Delivery. The project requirements and preparations are the same as those for Project 6A, with the addition of a simulation ventouse apparatus that is included in the kit. The assistant must use their dominant hand to apply controlled pressure to the balloon inside the box to simulate the baby's descent through the birth canal, but should stop short of crowning. While applying pressure with their dominant hand, the assistant should use their non-dominant hand to locate the baby's ears through the balloon. Then position their index finger and thumb just above them to simulate the mother's ischial spines. At this point, the obstetrician can perform a quick vaginal exam and simulate determining the fetal station by inserting 2 lubricated fingers into the vaginal canal and locating the fetal head in relation to the ischial spines. Confirm that the fetal head has passed the ischial spines and that the station is at +2. Once the vaginal exam is complete, the assistant can remove their non-dominant hand from the box, but should continue to apply counterpressure throughout the ventouse-assisted delivery to prevent the tiny baby from being pushed back into the uterus balloon. The obstetrician will now place the provided ventouse apparatus on the fetal head, making sure that no maternal tissue is caught between the suction cup and the fetal head. Secure the suction cup against the fetal head and grip the barrel of the syringe. Create just enough suction to form a seal by slowly pulling the plunger. During contractions and without breaking the seal, use the vacuum created by the simulation ventouse apparatus to apply a pulling force to the fetal head in an upward J-shaped line as shown in the forceps-assisted delivery video, pausing between contractions. Once the baby's head is free of the birth canal, remove the simulation ventouse apparatus and deliver the rest of the baby. If there are no signs of distress, the baby will be placed onto the mother's chest and covered with a blanket for skin-to-skin contact. The umbilical cord will then be clamped and cut as outlined in Project 6A. Optionally, the postpartum procedures for the L&D nurse from Project 6A can also be followed.